Hello, and welcome to another episode of How to Survive Healthcare. I am so grateful today. We have another guest. This is Miss Pam Dunwald, and she is here to talk to you about what you need to know about navigating long-term care. Pam has been an RN for over 40 years. Her experience encompasses many clinical areas, such as acute care, home health, hospice, emergency care, case management, and utilization review, working with bill insurance companies related to hospice cases. So Pam has had a wealth of experience in this area, and I'm so grateful you could come on today to talk to us about this, Pam.
Well, thank you, Kayla. I really appreciate it. And it's an honor and a privilege to be here. So I'm hoping that I can bring all the information that you want on this topic. So it's good to be here.
Thank you. Thank you. Well, take it away. Let's say I feel like my dad is no longer safe at home and I'm looking into assisted living or perhaps nursing home, but I see that there's the need, but I don't know where to go.
Sure. So to take that from the very beginning, there's a lot of scenarios that can play out. So if you have a loved one that's been at home and maybe you've decided, well, we tried to have this work at home and it's just not working. We think that they need long-term care. Well, the first thing that you need to consider is how is this going to get paid for? What are the financial responsibilities going to be? So Medicare, I'll maybe start right out of the get-go to look at the different ways that could pay for long-term care. So we've got Medicare, we've got the Medicare Advantage plan, the insurance side of Medicare. We've got insurance, we've got Medicaid, which is the state, Medicaid program, and then long-term care insurance or private pay. Those are the ways that a long-term care stay or move would get paid for. The average cost of long-term care depends on a private room. It depends on whether you're willing to share a room with someone. And it also depends on what part of the country that you live in. But the average private pay rate is between $8,000 and $9,000 a month for long-term care.
Wow, that is a lot. So most of our listeners, the family members they would be considering moving into care, I imagine would be receiving Medicare. How much does Medicare cover for that?
That's a great question. And so that's why with someone just from the outside looking in and looking at long-term care, that's a bit to navigate. So in order for Medicare to pay any part of that nursing home stay, they have to have an acute inpatient hospitalization for a minimum of 3 overnights. Okay. So that is the first criteria that someone would meet. So for example, if you go into the hospital, say you have an exacerbation of your congestive heart failure, you go into the hospital, doctor admits you as an inpatient, not as observation. Observation does not count, which is an outpatient status. Yes. So if you're in the hospital for 3 nights as an inpatient, 3 midnights, then you would qualify for a short-term care at a rehab or a nursing home facility. And how that would work is that days 0 to 20 would be paid at 100% by Medicare. But the caveat is that there must be some need for either skilled nursing or therapy. If it's just custodial care, Medicare is not going to pay a dime. So there has to be.
Can you define what is that custodial care?
Custodial care is basically when you're going to live there long term, you're not expected to get better and you just need a safe place to live.
Right. Got it.
And so if you're going there, say for wound care, or you need nursing assessment, following that episode of congestive heart failure, or you've gotten weaker in the hospital and you would benefit from some rehab, some therapy, then Medicare would kick in. And after, so 20 days would be completely paid for. And then 21 days to 100, there would be a copay, approximately $180 to 200 and some bucks a day would be your copay. And then after 100 days, so from day 101 on, Medicare no longer pays for nursing home stay. So
wow. Okay.
You would either revert to a private pay situation, long-term care, or Medicaid. So for example, you go in the hospital and your loved one feels, and okay, they're going to come home with me, or I think that the patient says, oh, I'm going to be fine. I'm going to go home. I can handle it. And say they go home and 3 weeks later, the family or the patient realizes, well, this isn't working. I can't make it at home. As
Right.
long as they've had that within 30 days, as long as they've had that 3-night stay, they can still go into that nursing home under the Medicare guidelines if they need,
Okay, so there is a
rehab.
little bit of a grace period.
Yes. And
That's
so
good to know.
Medicare considers 60 days an episode. So if they were home and it was past 30 days and, they didn't have 60 days of wellness, then it gets a little tricky. So Medicare is usually, when we look at insurance, there is, you have your annual deductible or your annual whatever those charges are. With Medicare, it's a little different. They're episodic. So with Medicare, it's every 60 days is a new benefit period. So you could have that deductible every 60 days. So they're a little bit different. So we don't need to get into those weeds. So
Sure.
If you're not in that, if you don't fall into that category of that 30-day window where you've had a hospital stay, then Medicare is not an option to pay for nursing home or long-term care. So then
Okay, and even if you are, it sounds like, correct me if I'm wrong, Medicare, it's only part of it for the first 100 days. And then if ultimately the person stays in the nursing home, it still has to be financed in some other way. Is that correct?
Yes, that is correct. And that's why we get, as advocates, that's why oftentimes we'll hear clients talk about, oh, they're kicking me out of the nursing home. Well, that means their Medicare is run out. And if they can't say they can pay privately, then there's no payer source for the nursing home. So they don't use the term, obviously, kick you out.
Sure.
But they have to transition you someplace else because there's no longer a payer source. Now, the nursing home, when I say that, there are ways to be proactive with that. So, the social worker in the nursing home should be able to anticipate that and maybe work with you to get your Medicaid application in to see if you qualify for Medicaid, or to look at what other avenues. They shouldn't wait till the last minute. So
right,
there are things to do to kind of circumvent that, or try to work before those 100 days run out.
So for people who are in that boat where they're anticipate using the whole 100 days and are starting to think about how to finance this in another way, would you say then that Medicaid is the most common?
It is. Medicaid is the most common. The only challenge with Medicaid is, and every state is a little bit different. So
Sure.
the problem with Medicaid is you can only have, and it's approximately, depending where you live, approximately $2,000 to $2,500 in assets. That's it.
That's not much.
It's not. So you can have a car, you can have a home if you're living in it, but obviously if you're not living in it and you're going to be living in a nursing home, that home is going to put you over assets. So a lot of times you'll hear the words with social workers or other people that are working with clients in the situation, you'll hear the term spend down, which means basically you have to, do something with your assets in order to in order to qualify for Medicaid. So in this instance where maybe someone owns their home and they're going to have to go in a nursing home, well, then the sale of that home, then that money would go towards to pay their nursing home stay. And then once their assets were depleted and they came under that income cap, so to speak, for Medicaid, then they could go on Medicaid, but they would have to utilize all their assets first. So if someone is concerned about that topic, what I highly recommend you doing is having that discussion with a estate planning attorney.
Yeah, I can see how that would be helpful. So moving on to maybe the next group of people who is not interested in removing all of their assets, but does need to go into a facility, would paying privately be their only option, or there are some other insurance options?
The only other insurance option would be is if they were fortunate to have long-term care insurance. And that is something
And
that
how
they
does
would have
one obtain that?
through your regular insurance agent, your life insurance agent. Yes, they would be the ones that would get a policy for you. They are, I guess, as not an insurance agent, I can just tell you from experience, there are many different long-term care insurance policies. So you really have to make sure that they explain what exactly is covered and for how long. And they can be quite expensive, but that would be another avenue to avoid private pay.
Okay,
But
that makes sense. Okay, so I think we've covered all of our areas of financing the
mhm,
stays.
mhm.
What are some of your biggest suggestions or the key points that you have learned for actually choosing a facility? Like somebody who's never done this before, what are some of the big things they should be
Mhm.
looking for?
Great question. So there's a couple of different options depending on if you're a do-it-yourselfer or if you like a little help. But I always my first go-to resource, every county in every state across the country has a Department of Aging, Senior Resource Center, Aging and Disability Resource Center, whatever your county, or your state calls it. That is your number one go-to. Number one, they are going to know all the nursing homes in your area and be able to provide you with all the information on the nursing homes. They also would be your go-to person to ask questions about financing and whether you might qualify for Medicaid. So they are always my number one resource that I send people to. Um, the
Sure.
number the number two resource to assist you would be, if you want a little help, would be the social worker, either at your clinic or at your local hospital. I know at the hospital I worked at, even if you were out of the hospital 6 months and you didn't meet that Medicare, but you were in the hospital 6 months ago, you can still go back to that hospital social worker and say, "Hey, now I'm looking for a nursing home. Can you help me?" And they actually will help make referrals and talk to you. So the clinic social worker or the hospital social worker, those are also two great resources. And all your clinics have them and your hospitals have them. So sometimes if you haven't worked with them, you may not realize that that service is available at your doctor's office. So those would be
Good to know.
my first two go to. And then if you're more like a do it yourself or you like to do the research, and some families do, they like to kind of figure that out on their own. Every state has what they call an ombudsman, and I think it's OMBUNDSON, I believe. Um,
Mhm.
it's called an ombudsman, and what that is a government agency, is like an advocacy agent for patients that are looking for long-term care, or they've been in the hospital, and they're kind of an advocate, and it's a for Medicare recipients. So it's kind of they have many pieces of information. So for one, Medicare Compare. And what I could do, Kayla, is when we're done, I can send you some of these links so that you can
Oh yeah,
include
that would
them.
be perfect.
So there is a website. It's called Medicare Compare for nursing homes, and you can actually go to the nursing homes that you're in question. You can look to see how Medicare's rating them. There's several different criteria that they would go through to see the quality of care, if the state has, if there's been any disciplinary action on them, if they found to be deficient in any area. You can get all this information from this Medicare Compare. So that's a great place to start to see what the quality of the care is at the nursing home
Yeah,
that
that
maybe you're
sounds like a
considering.
super helpful tool
It is.
because I
And then,
think that's
mhm, go
That's
ahead.
a huge area of concern. I think all of us have probably heard horror stories of family members in nursing homes and, perhaps not getting quite the level of care that they should be. And I'm going to go out on a limb and say that anybody who is placing a family member in a nursing home, that is a top area of concern.
Absolutely. And like anything else, there's good quality and there's less than good quality. And so that's one way, because that's actually information collected from either reports of complaints or their annual state survey. So this is not subjective data. This is actually legal data that is collected and then investigated, because every time someone, if a consumer would call and make a complaint to the state on, say, something in a nursing home, that generates a survey. So the state actually has to go into the nursing home and investigate all complaints, and then they determine whether it's justified or it's not. So anytime they've justified any issues, you're going to find those things on that nursing home compare.
Yeah,
So
that's a phenomenal resource.
it is. So the next thing that we recommend too is go visit the nursing home. You can, they actually recommend making 3 visits. You might want to call and schedule a visit once so that you can get the full tour. And so, but you're going to, when they schedule those, you've got to understand that it's like an open house. They're ready for you. They're prepared for you.
Right.
So
right.
they also schedule, or they also suggest, or not scheduling, but making possibly 2 other visits, both at different times, maybe one in the afternoon, maybe one in the evening, so that you're seeing how they are in a normal day-to-day, and use all your senses. What do you hear? What do you see? What do you smell? Do you hear call lights going on? How long is the bell ringing before, maybe that it gets turned off? So you want to just see how, just observe and see how you feel people are being cared for, during that visit.
Yes, and I'll add to that. Look at the nurses, and if you can, talk to them and see how many people they're taking care of. I have done some kind of fill-in duties at nursing homes, and I'll tell you, the best nursing home I worked at looked the worst. It was honestly kind of scary, looking like something maybe borderline out of a horror movie. And it was the ratios were phenomenal. And the staff could really care for those patients. And the worst one that I worked in was in a very affluent area where everything looked so nice, and they just saved their money on nurses. That's for sure. So that was the looks can be deceiving.
That's a great point, Kayla. And too, the ratios also are included in that Medicare Compare. So there is a lot of information that you can get from that. But that's an excellent point. And we know that nursing homes is not a huge moneymaker for a lot of companies. So that's a great point when you say that is maybe there's less in the aesthetics of how it looks, but the care is better. So great point.
Right, absolutely. And if I had to choose or weigh in, if you're between 2 facilities and one maybe looks nicer and has better food, but the nursing care is better at the other one, that really is the reason that you're seeking this facility. You can always dress up the room a little bit or visit your family member and bring them food. But the nursing care is really what's going to drive whether they do well or do have some of these complications that you hear about when there just simply isn't enough care to go around.
Yeah. And one thing I'd like to bring up too is oftentimes when families are looking to have to place an elderly loved one into a nursing home, oftentimes it's related to some form of dementia. So you're going to hear the term memory care a lot. So if you're looking, if your loved one does have dementia and you're looking at a long-term care facility that advertises or says, oh, we have memory care, you want to look at that also a little bit deeper. What do they mean by memory care? Do they just say, oh, they accept patients with dementia, or do they really have like a separate wing where maybe it's locked, where someone has to ring or buzz to be able to leave that unit? What actually, what safety measures are actually included in what they term memory care? So that would be another thing if you're dealing with dementia, to really ask a lot of questions about what do they mean by memory care.
That's a great point. Well, Pam, you've brought us a lot of great information today. Is there anything else that you'd like to add in?
No, just that it's a big decision to look at long-term care, especially since the pandemic and all the hot topics as far as, senior isolation and things like that. We didn't talk a bit about that. So I guess one other thing is to try and combat that, or when if you're feeling guilty and you're worried about the isolation, ask to meet with the activity director. Every nursing home has someone in charge of activities. What do they do? Do they bring music in? Do they have outings for those that can participate? Our assisted livings are really, pretty good about that. But when you're looking at long-term care, do they have bingo? Do they have, what are they doing to keep their residents
Right.
engaged? So that would be one other thing to look at. But no, I think that's the biggest thing is to check out, check with the ombudsman, check out the Medicare Compare, reach out to the aging disability or a social worker at the clinic or the hospital, because they're always happy, or an advocate that specializes in senior care. That would be another option. But there's lots of help out there, so don't be afraid to ask for help.
Absolutely. If one of our listeners is listening to you and says, you know what, Pam knows what she's talking about, and I'd really like to reach out to her for some help with this, what's the best way to get a hold of you?
The best way would either be we have an 800 number, which is 888-330-MY-RN, which is 6976, or you can email me at pam@yournurseadvocateconsulting.com. So those are probably the two best ways to go ahead and reach us.
Okay, great. Well, thank you so much again for your time, Pam. I've learned so much. I hope this was helpful for the audience as well. And once again, everybody who's listening, this was a topic brought that was requested by a listener. If you have a topic that you'd like to hear us talk about on how to survive healthcare, please reach out. You can find me on Facebook and Instagram at Heard for Life, or go to the website www.heardforlife. That's HEARDFORLIFE.com. Thank you all. Have a great day.
Thank you.